We're blessed in the myeloma world right now to not only have seen tremendous momentum in the last 2 years with multiple new agents being FDA approved, but actually to have, I think, a fantastic future of novel approaches. So I'd highlight a few areas, I think, of major research where we're moving forward. The whole area of immunotherapy continues to be very important in better leveraging the immune system against myeloma. And we've seen even at this meeting here, novel agents that otherwise may not have been a part of our portfolio being used. Drugs like selinexor, novel monoclonal antibodies, even an agent like Venetoclax, which seems to have clearly a place in lymphoma and leukemia, now has a place in myeloma, not only in a small subset of myeloma patients with translocation 11;14, but it appears in combination with bortezomib. So I think the immunotherapy world is going to be important. I think another area that we're particularly interested in that is almost not even quite ready for prime time, but to have people understand this, I think, is critical, is this method now that we have where when we diagnose a patient with myeloma and we take a sample of their bone marrow, we actually take it into the lab and incubate it in such a way that we can test it against multiple different drugs to predict their response to that agent. Now, it's not perfect yet, it's not changing our practice, but this era of personalized or individualized medicine is genuine. If we add that dimension to understanding someone's own genome and how that might influence their response to therapy, I think the day is going to come before too long where we're not just going to have a standard first, second, and third line approach where we will specifically with a patient say, your kind of myeloma is more responsive to proteasome inhibition than it is this kind of approach, so this is the way we need to treat you from the very start. I think our genetics, make up who we are, and we've come to appreciate that there are genetics that are specific to the myeloma cell line, but it's as I like to even teach patients, so if this is your disease and this is your inherent genetics, there is an interaction between them. So to only understand the disease is only to understand half the equation. And so in fact, even at Mayo Clinic, we have a very broad program now to genome sequence many of our patients to better understand their inherent genetics. And as you've mentioned, that's obviously very much influenced by people's ethnic background. That may allow us to understand, in myeloma, it's twice as common in the African American population than the Caucasian population. Well, we should be able to understand that better, and what is it that results in that, and how can we use that information obviously to bring better care to those patients.